key box.
I gotta write that down.
A key opens
You
the
know,
box.
apples can be in the box.
How about curtain?
Why don't you pick an animal, a fruit, and an article of
No, because
clothing?
animals eat fruit.
Yes.
And remember, there's no orange kangaroos in Denmark.
So mine was mountain cow and kite.
Mountain
Cow
cow
and kite.
and kite. Okay. Mountain cow and height. Okay.
Okay.
All right. Can you tell me the last historical event that you remember?
Oh, that mass shooting that happened recently.
Oh, that's right.
But
there was
isn't it
another one.
remote? So wouldn't that be like where were you born or something from your childhood?
Kind of, sort of.
Isn't it?
Not
Or is
necessarily.
it?
It could tell you a lot because, like, my mom, she remembers. She remembers 9/11. She remembers when Kennedy was shot, but she does not remember that there's a war in Ukraine.
But isn't
You know what I mean?
remote remembering like trying to recall something from way back when?
No. Remote would be more like the items that I listed off.
Oh,
Because I'm going to have her
okay.
recall it
Alright.
within
Oh,
like
okay.
5 minutes.
Oh, okay.
Yeah.
I already forgot some
Distant
items.
would be a historical one.
Mountain cow kite.
Thank you.
Well, it was a little
honestly-
confusing, like all of the other ones. We're good. Yeah, we can do
Okay.
it.
So, immediate, recent, remote. Now, it says balance and coordination. So now I'm going to have you stand up. Okay. And I'm going to have you walk 5 steps that way, just like your normal walk, and then stop, turn around, and face me.
Okay. 1, 2, 3, 4, 5. I guess I have to count.
Okay. On your way back, do me a favor and walk toe to heel.
Totally.
Okay. Go ahead and turn around. I'll have you walk tiptoed. And then on the way back here, on your heels. Okay, perfect.
I feel like it was like.
It feels weird, it really does,
Yeah.
especially when you're doing the heel walk, because most people will do, kids always will do this, they'll walk on their tiptoes or whatnot. And how many people do you know on even a regular basis will walk around like this?
That's okay.
It looks uncomfortable. That's what it looks
It
like.
is a little, it feels weird, it does. Okay, but again, they're able to follow commands and follow through and stay upright and not be all, you know what I mean, and coordinate that way. All right. So, actually, before you sit down, let me have you stand back up and go ahead and close your eyes. Both feet together, hands to your sides, and close your eyes.
Oh, sorry.
No, you're fine. And what I'm looking for now is to see if she starts swaying. A little bit is fine,
Yeah, I'm like, I can feel it a little
Yeah.
bit.
because a little bit is fine, because your body's going to, as long as it has a good sense of orientation and equilibrium, it'll correct itself. But if they start doing this, that's an issue. Okay, and so now I would, wait 5 or 6 seconds just to see if she does anything. She's not, so go ahead and open up your eyes for me.
So scary.
That would be a negative Romberg. We want a negative Romberg.
Mm.
Okay, we don't want a positive one because that means your equilibrium's off.
And that can relate to ear problems, right?
Inner ear problems,
Got it.
typically. Yep. All right. So now we're going to do the finger to nose. So go ahead and put your arms out, close your eyes, and bring your index finger to either hand to your nose. Okay, and then the other side. There you go. One more. Perfect. Okay, go ahead and stop. Now go ahead and put your hands at your side, and with your right arm, touch my finger. Right finger, I should say.
It's like a game. Like,
It is like a game.
It's almost like that one when you go to the eye doctor and they're like, all right, straight at the dot, and they do the,
mm-hmm.
you know, the little wiggle line thing.
Check for macular generation.
Mm-hmm. Well, peripheral, yeah. All right, so we did the finger to nose, we did the finger to finger. Let's do the other side.
I'm like,
Not as good with that one.
my left is not as good as my right.
But are you right-handed or left-handed?
I'm right-handed.
That's why.
So she's like left-handed.
If she had no swaying, that's
Negative.
That's a negative
negative,
Romberg.
which
We
is what
want
you
that.
want.
Yep, we want a negative Romberg. All right, finger thumb opposition. So actually, now you can go ahead and sit. And I'm just going to have you do on your hands just pretty much, but double tap your index and your pinky when you get to them. So 1, 2, Yep. Okay, perfect. Go ahead and take your right heel and drag it up your left shin. Okay, and the other side. Okay, so those are both good. She's able to complete both of those with no problem. As far as coordination. All right, finger to nose, heel to toe, shin test. Now this is where I need my sense, and it doesn't look like we have any coffee.
You got some in your cup, I think.
We
She
got
gonna be off. She gonna be off. Hazelnut and vanilla.
You want mint?
Yes, please. Ideally, you want coffee grounds because they're stronger and everything. But you want to definitely have something in a container that they can smell. So
I
go ahead and
can
close
smell
your
it
eyes. Caffeine.
Me with my
caffeine.
textbook sucking bewilderings, yeah.
All right. All right, go ahead and close your eyes and tell me what you smell.
Mint.
Okay.
Coffee. It's not good too.
Ooh, that's
Cassidy brought it up for all of us.
Yeah.
Yeah.
Smell no poo with that.
Mhm.
Well, you want it. I will say this though. Be
You
careful.
will want to go poo if you have
Be
that.
careful putting this in a patient's room, especially if they have diarrhea.
Oh no, I just put it in my mouth.
Yeah,
Yeah,
yeah.
it's in our mouth.
But
Oh,
I'm
I
just
can
saying,
smell it.
right? It's pretty strong.
Yeah,
Well, there's a reason why when you go out to dinner, what do they give you with
They
your
give you
bill?
mint.
Mints.
Mints. It's to help facilitate.
I never
Digestion.
Knew that. I thought they were being nice.
I did too.
And if
I
you
had
have
no idea.
patients,
Me either.
if you have patients who have diarrhea in the hospital, yeah, it stinks, but it's better for you to put coffee in the room to absorb the smell than to put this because it's going to facilitate more.
Oh, I can do like a hot fresh cup of coffee and just sit in their room and let it
just the grounds.
Oh, the
grounds.
grounds.
Yeah,
Someone
it'll
go to
absorb it.
Starbucks. Can I just have the grounds, please?
It needs to be dry. I
Dry
will say.
grounds.
But yeah, no, that's what we do in the ICU. We'll take a thing of the coffee with filter and we'll put it at the high point in the room so it absorbs the smell.
Huh.
And we'll change it out every so often.
Yeah.
Mhm.
Never know.
We were doing that in the rooms, and then we were realizing that there's more and more. You know what I mean? And so we were like, well, let's try something else. And one of the aromatherapy instructors or practitioners was telling us that, hello, this is why they give you mint
I had
at
no
dinner.
idea.
Yep.
Right?
All right. So olfactory nerve is intact. She was able to distinguish between one odor and the next. Okay. So now we can do a standardized vision test or Snell and chart. What's the other name? Rosenbaum. Rosenbaum. It's Romberg and Rosenbaum. Mhm. All right, so we don't seem to have one of those either. We're supposed to. Usually it's on that cart. But I would say have them look at the chart and tell me which is the smallest line or the smallest numbers or letters that they can read.
Will we have it for our checkoff, do you know?
I'm hoping so. If not, as long as you mention it,
Okay.
that's fine.
Okay.
Okay?
Because my eyesight's bad. You don't want to know.
It gets worse when you get older, trust me.
Oh no.
All right, so that's the visualization test. Now I can do my pen line. So, oh, thank you.
Oh, I don't know why it's on already.
She's like, oh.
They're always on.
I
Get
know.
bombed.
That's why I say get the ones that you can replenish the battery.
That
Because
is
if
the
you
one you
get-
can
Yeah,
replace.
Yeah.
the
it just
battery.
has a
Do it-
push button.
Yeah, if you get the, well, at least because you replace the battery, not the
Yeah.
whole thing.
Right.
You know what I mean?
I
Whereas
have
the
two.
other ones, there's ones that you just push right here to engage it, and they get stuck all the time in the on position, and then you're tossing that out and all that good stuff. But, all right, so now, if I was in a room and I had control to turn off my overhead lights, I would turn those off to make the room as dark as possible so that I have an easier time of seeing any change with her eyes. But again, I'm not going to go directly in her eye with the bright light. I'm just going to give it like almost like just across the eye so that it's exposed to the light and I should be able to see if it constricts or not. And I'm going to look at both eyes. So just like that. I'm looking at both. Even though I'm checking one right now, I'm looking at both to make sure they're both constricting, okay? Because they should be congruent in that movement. And then I can now have her follow the tip of my pen here. Even though I did a little bit of this earlier when we were doing the finger to finger thing, okay? And now I'm really concentrating on that. And then follow the tip here. Okay. So now I can say pupils are equal, round, reactive to light, and accommodation. Okay, so pearl is intact. So 3, 4, and 6 are all good.
I have a question real quick, sorry.
Yes, ma'am.
So for the Snellen chart, are you having them do both eyes or one at a time and both?
For the purposes of the checkoff, we're just having them do both.
Okay.
Yeah. We're all going to assume that everyone here has good vision, even though some of us have to wear glasses. But in the field, if they weren't able to get to a 20/20 with both eyes, we would then go in further and see which eye is stronger than the other.
So I'll be like, right eye and left eye.
Mhm.
Both. No, it's kidding.
I can't see nothing.
KL. Yeah.
Alright, so now I'm going to have you close your eyes, and this is where my cotton ball would come into play. Again, another tool. Oh no, we do have cotton.
Don't forget your reflex hammer while you're over there.
He was ready.
Oh.
Oh, no, never mind.
Don't gag on us, okay?
No.
That was a mighty one.
Go ahead and take one, each of you guys. But you only need a little bit.
So what's the leaders?
Just a wee little bit of whiskey. Okay? So go ahead and close your eyes and tell me when you feel something on your face, okay? Or where you feel something on your face.
Cheek. Forehead. Chin. Chin. Cheek.
Alright, let's rock.
I went middle of my forehead.
But forehead would have been fine.
Okay, we're at.
Okay, so that's the sensory aspect of which nerve? Trigeminal, or 5. Okay, so now I'm going to have her go ahead and bite down for me and feel that muscle is engaged. Go ahead and relax, and then it relaxes. All right, and that's that part. Next. Woo. For facial, we're going to have her smile, frown, puff out her cheeks, raise her eyebrows, and close her eyes big. So go ahead and smile for me nice and big. Frown, big and fat. Puff out your cheeks.
Raise my eyebrows?
Raise your eyebrows real high. Close them real tight. Okay, perfect. Everything was nice and symmetrical. Both sides were doing what they were supposed to at the same time. So now we can say that facial nerve is intact. Acoustic, this is that really very technical exam.
1, 2, 3. Why am I whispering?
I don't know why you're whispering, but that's okay. ABC! No.
I think we are.
Oh, CBA? No, I'm just kidding. XYZ. So loud. I like startled.
Whisper test positive, so her acoustic nerve is intact.
Oh, yes.
Glossopharyngeal or gag reflex. All right. Now I'm not going to actually do this because I don't want anybody to go. Oh! But what I am going to do is I'm going to get down here. I'm going to have my patient open up their mouth. And I'm going to put their tongue down. And when they're making that sound, I want to see that the uvula moves. Okay? So, Okay, perfect. And that's all I'm looking for at this point. Okay? If the uvula didn't move, okay, because that's one of the ways our body protects itself is with the uvula sense when we're swallowing. Okay, and it kind of signals to the epiglottis to cover the air hole, all that fun stuff. So if the uvula wasn't moving, then I would go forward and elicit a gag reflex. Okay, because then I need to make sure that cranial nerve is intact.
Do you want us to mention that so when we're checking to see if it moves, but then say if it doesn't, then we're testing for the gag reflex?
Just say that the uvula is moving so I don't have to worry about it checking the gag.
Okay.
And that's fine. Okay?
Tastes like popsicle and wood.
The other thing you want to do too is this, like going back to head, ears, eyes, nose, and throat, have them swallow. Go ahead and swallow for me. just to make sure that there's a sensation of movement there. The Adam's apple or the trachea should move up and down. Okay?
I know, I'm feeling it too.
Right. So now we're going to move on to the spinal accessory. Have them turn their head laterally, side to side. You can do up and down as well.
This is when I missed it.
Or, you know, oh my God.
Oh my God.
Right.
Like.
And then the other one to test, if let's say they've got like a stiff neck, okay, they can't really turn or whatnot, maybe they got a headache or something. Hands on their shoulders and have them shrug. That's it. Okay, that works too.
I don't know.
All right, now hypoglossal. We kind of did that already when we had her stick her tongue out for the ah. It was nice and midline, but if you need to do it specifically, go ahead and stick your tongue out for me. Perfect.
Would
It's
you,
nice and
would you
midline.
count that in our, like, with that whole, like, tongue
If,
thing?
as long as you mentioned it.
As long as I mentioned, stick your tongue out?
Well, no, if you mention, you know, while you're having her stuck her tongue out, her tongue is midline, so the cranial nerve 12 is intact.
Oh, I have to say all these cranial nerves, huh?
Either hypoglossal or cranial nerve 12.
Okay.
Yep.
I'm
Okay.
like trying to curve my tongue. No matter how hard I try.
I don't know, mine just sticks out the side. I don't have a long tongue. All right, so the two that you guys, I'm gonna actually have you take your jacket off if you could, please.
I'm not doing that.
You go for a ride or
Whee! Sorry.
She slides down.
I love my feet dangle.
Now let's see what cranial nerves in town.
All right, so the two that I will be testing you on are the tricep and the patellar. Okay, those two. So the tricep one, you want to be careful because you're right next to the funny bone or the not so funny bone. Like this
Why
one,
do
you
they
want to
call
have
it funny bone?
because it makes your arm feel funny. If you
But
hit
it hurts. So it's not funny.
But I'm going to have you bring your arm out to the side at a 90-degree angle here and here. Okay. I'm going to take, because her biceps are small enough to where I can wrap my finger around here, but I'm going to block this area. I don't want to hit this directly like this, because then I can hit that nerve in her arm and make it really uncomfortable. So I'm going to put my finger here to hit that first, because you're only needing a little bit of kinetic energy. Okay, go ahead and relax your arm. Let me hold on to the weight. There you go. Got a little bit of one.
I see. Just hit her.
I see that.
Shay, get off your arm.
I'm alive.
Alright, is your arm relaxed?
Oh, sorry.
Just fake it.
There we go. Just wait for me to hit you.
Work on these acting skills.
Right?
Come on.
Are you actually testing it? Because it's not working.
Oh, that one did.
Yeah,
A
it
little
did.
bit.
It moved a little bit.
Okay.
It's just like the.
Now, would you say that was expected or a little less than expected?
Oh, it wasn't.
Less
A
than
little less than
expected.
Some is better than none, no.
Little anti-galactic
Okay.
over there.
Now down here, you ladies come on over here real quick, just so I can show you guys a little bit better. I'm not gonna check her like this, because I feel like singing like Mickey Mouse. But, exactly. But you're going to feel for the base of the knee bone, the patellar bone, okay? Hers are relatively small. Hers fits right between these two fingers, okay? So I'm gonna go at least a finger breadth below the lowest point of that. And right there is where I'm aiming to get her reflex on her knee. Okay? Close your eyes and relax.
No, she can't relax.
Shay.
Shay, relax.
Oh, there you go. Well, that's unexpected. You're gonna make sure you're fine.
It works. Trust me.
Ow.
You don't want to do it here. That'll definitely hurt.
Oh, yeah.
But there, you can feel that there's a little divot where the ligament hangs over the joint, and that's where you're trying to go. Okay? So if you do it too far up here, you're hitting the
Oh, that
actual
don't
knee.
hurt.
Yeah,
Yeah.
you're hitting the knee. And even though this is rubber, it's still hard rubber. Okay? So again, I still, even to this day, when I'm checking, if I'm having to check reflexes, I will make sure that I'm doing, this is my spot. You know what I mean? And then, there we go.
Doesn't matter with your reflexes.
Hurt. Hey guys, this is realistic. Okay. Not everybody's perfect.
Well, and going off of what we talked about this morning, what electrolytes would I be worried about if she has deep or slow deep tendon reflexes?
Sodium.
Sodium.
Because it has just muscle.
Low sodium?
No, it's more with nerve conduction.
Nerve,
at this
oh
point.
yeah, nerve
Salad.
conduction.
With the
Wait,
turkey
low sodium?
meat stuff.
It was probably high sodium, right? Or is it low
It's
sodium?
actually, well, it could be both.
Oh, really?
Yeah.
Either or, so just really high or really low.
Sodium.
Mhm.
I didn't have a lot of salt though.
But there'd be other things going on that I would look at to help with, you know,
Should
determining
probably
if
do
it's
a
high or
full
low.
workup.
Probably. Just do a full head
We're gonna
count.
send you to the lab to get some blood drawn.
I got it.
She's like, I got it,
I
I'll
got
do
butterflies
myself.
in my car, actually.
Okay.
I don't tell anybody. I don't practice at home. I know.
Happens in lab stations.
I'm like,
Right.
all right.
Didn't happen, YouTube.
It didn't happen, you too.
Right.
This is not for children.
No.
One thing I skipped over was to check sensory functions, light touch versus sharp and dull. That's where this will come in as well, okay? What I was taught was to take one of these, snap it in half so you get these nice little jagged edges on the side for your sharp, and then the other side for your dull, okay? But I was told we shouldn't be doing that here.
We had to refrain.
So, well, I mean,
Splinters.
splinters, and actually, you know, if a student who's not very experienced does it too hard, they can cause injury. So we're going to use these instead. So this will be your sharp edge, and when you feel on it, you see it's pretty sharp, enough to elicit a response. And then this side, or even this side, can be your dull. Because it feels different, does it not?
It does.
Okay, so what I'm going to do now is I'm going to have you close your eyes, and I'm going to have you tell me whether you feel something sharp or something dull.
Sharp. Sorry.
Dull. Dull.
Sharp. Sharp. Sharp.
Dull.
Dull.
All right, and that's it.
Did I get it
so
right?
now, yeah, you did.
Oh, cool. I was like close.